So, Dr. Janet has finally decided that we'll devise a scale which is objective enough and simplified so that it's very easy for people at every level of nursing care or the healthcare can reproduce the scale. So in 1974, Dr. Janet, who is a neurosurgeon, has devised this scale, and this scale, the main advantage of this scale is it can be used by people with minimal knowledge in healthcare also. So what is the use of the Glasgow Coma scale? It quantifies the level of consciousness, it assesses the initial level of consciousness, and it assesses any change in the level of consciousness. And this change in consciousness helps in guiding the treatment protocol. This particular chart is something which you have to remember it and memorize it, and probably by the end of this presentation you shall be able to answer it back. So, what are the components of the Glasgow Coma scale? We have three parts for the Glasgow Coma scale. One is the eye opening, second one is the verbal response, and third one is the motor response. And eye opening has 4 points, 1, 2, 3 and 4. Verbal has 5, 1, 2, 5, and motor response and 6. So it's 4, 5 and 6. For eye opening 4, verbal response 5, motor response 6. I'll be explaining you what does each sentence over here represents in the next things. So before I go into the scale proper, Glasgow Coma scale involves initially we'll have to observe the patient, and then you will have to stimulate the patient. There are well-defined protocols of how to stimulate or give painful stimulus to the patient. So these are the various methods in which you give the painful stimulus. So how am I giving the painful stimulus in this particular slide? I am using a pen or a pencil to apply pressure on the nail bed. Trapezius. This is the second way of giving the painful stimulus. You identify the supraorbital notch and give pressure on the medial to the supraorbital notch. This is the third way. You pinch the trapezius muscle between your index finger and thumb and you apply a firm pressure. And this is the last way where you apply pressure on the sternum with the help of your knuckles. These are the four described ways of giving the trapezius. And even though all the four methods can be used, there are some protocols. If you are examining for the eye response, the supraorbital pressure should not be used, because even if the patient is consciousness, because of pain, he will wince, he will grimace, and he will not open the eyes. He will tightly close the eyes.